Do you ever get wrist problems? It's very common to have temporary pain or pinching in the wrist sometimes. This is a model of the hand, and you can see all these tiny little bones here. These are the carpals. They kind of slide around in there. And then these are the longer bones in the hand. So this is actually the heel of your hand. That would be right here in the heel of your hand. And this is where the carpal tunnel is. And there's a piece of fascia that goes across there on the heel of your hand here. And that's what forms the carpal tunnel. Now what goes through that tunnel are mostly a bunch of tendons. So the tendons come from the muscles in your forearm, and some of those tendons go all the way up to the tips of your fingers. So there's a bunch of them, not just one. And the other thing that passes through that tunnel is the median nerve. And the median nerve is what often gets compressed. That's when you have a problem, is when you smash the nerve, when that tunnel gets too small or when the things inside of it get swollen. And this nerve will branch out and feed into the muscles of your thumb, so the thumb side of your hand. So you can have some tingling, but also maybe muscle weakness, especially in these muscles here, if you have a long-term problem. But that's not as common as just the general pinching in the wrist. But they can be related. Some of the causes of actual carpal tunnel are the same causes of pinching in the wrist, which would be tendinitis or muscle tension, muscle imbalances in your the muscles that help you clench your fist. Now, where are those muscles? Those muscles are going to be located in your forearm. So those muscles are all the way up in here on the back of your forearm as well as the front of your forearm, and they go up here, and the flexor muscles go through that tunnel. You can see them pop out here and go up into your fingers. So if you have misalignment or imbalances in the muscles in your forearm that help you grip things and move your fingers around for typing and stuff like that, that can have an effect sort of on the alignment of these little bones. And then when you go to really flex or extend your wrist, you just get a little minor pinching, maybe on the little finger side or maybe on the thumb side, right? That's different from carpal tunnel, but it can lead to it. If you have a lot of misalignment in the wrist, then you can get tendinitis, and tendinitis is when you get inflammation inside the tunnel in those tendons. There's other causes of carpal tunnel, including just general inflammation or edema, where you get water accumulation in the body, and that makes the whole body get swollen, and then there's some compression in there. That happens with hormonal changes sometimes, or with pregnancy. And some wrist problems are related more to shoulder compression. If you get compression in the thoracic outlet, right here, you can get similar symptoms as you would have with carpal tunnel, but it's not related to the wrist. In general, if you have a wrist problem, you can work in your wrist, fingers, forearm muscles, stretching them. I'll show you those in another video. And you should also work on shoulder mobility, shoulder alignment, and even neck, cervical spine alignment, and thoracic spine alignment, because that can affect the way that your shoulder blade sits on your upper back. So it's never just one thing. The symptom will show up in one place, and you may need to address it through various means. In the last video, I talked about the wrist and the carpal tunnel, how the wrist flexors and finger flexors go through this carpal tunnel right here, and they come from your forearm. Those are the muscles that help you make a fist and also do wrist flexion. They come from your forearm, and then they end up on the medial epicondyle, this inner part of the elbow here. So you can get tendinitis here. Usually it'll show up right in the elbow, and you'll feel it when you're using those muscles or making these movements, or maybe gripping really hard if you're doing some kind of weightlifting or pull-ups. So that's a really common medial epicondylitis or tendinitis here, flexor tendinitis. The way to stretch that, the best way to treat that is stretching. And you need to pull your fingers back, because those muscles go all the way to the tip of your fingers. So you should stretch it in this way, all the way to your fingertips. Now on the other side of your elbow, so that's the medial flexor tendons, and then you have your extensor tendons on the lateral epicondyle, or the outside of the elbow here, and those go up the back of the forearm, and what they do is extend your fingers and extend your wrist like this. So that we use those a lot in typing, because you have to lift your fingers up, but they're also used in making a fist. Right? When you make a fist like this, you're using your flexors and your extensors, and you can feel that if you just make a fist and feel the muscles here and the muscles here are both contracting. So the way to stretch this is a little tricky, because it looks like you could just flex your wrist and that would stretch these muscles, but actually you have to roll your fingers up, because those some of those muscles and tendons, and really have to think about fascia and connective tissue, goes to the tips of the fingers. And you'll feel a difference if you curl your fingers up like this, and then also your wrist, you see? And then stretch, and you're going to get a nice stretch here. So that's the best way to treat yourself for tendinitis in your elbow. The other thing you can do is gua sha, scraping technique. That's really helpful, or some kind of myofascial release, and of course acupuncture works as well. One thing that I'm really passionate about is teaching people about the myofascial pathways. And of course I get a lot of this information from Anatomy Trains, written by Thomas Myers. It is a great book, and it helps me to make the connections between the physical anatomy, the muscles and connective tissue in the body, and the meridian system, or the energy anatomy. Really fascinating stuff. If you want to release your spine, for example, if you have tension in your neck, very common to have tension in your neck, and it makes it difficult to turn your head or look up or look down. It's better if you understand the myofascial pathways when you're doing the stretching. Instead of just stretching your neck around in these different directions, it doesn't really work. And the reason is because it's pulling the structures with it when you do that. It's pulling your shoulder. I mean, if you want to stretch your head to the side, often it'll just drag your shoulder with you. So one thing you can do is really extend out through your fingers. We do this in the fascial stretching, so you can really extend as far out as possible through your fingers, and then tilt your head, turn your head. Or what you can do is reach down through your fingers, and I can use my other hand to pull my hand down, pull my shoulder down my back, and then tilt my head. It's nice if you tilt your head to the side and then chin down a little bit. So you're anchoring the fascia down through your fingertips, and then tilting your head, and then dropping your chin, and you get a stretch of the full, complete myofascial pathway, so that it's not just compressing and moving around your cervical vertebrae, but stretching the fascia. That's what you really want to stretch when you stretch. Remember, when you stretch muscle, what you have to do is relax the muscle, and that's controlled by your nervous system. So breathing is important, but when you stretch fascia, you have to hold it a little bit longer, and also move your breath while you're stretching. And things that affect the myofascial pathways in the body are previous injuries, movement and postural patterns. So ways that we habitually move, those are affecting the connective tissue in the body. And also hormonal changes or just aging can affect the connective tissue quality in the body. So it's important to keep moving, do different kinds of movements, explore new kinds of movement. Yoga is really good for that because you're moving your body in all directions instead of just the normal habitual patterns. So consider working if you have spinal problems in your neck, for example. Consider working all the way down into your fingertips. If you have lower back pain or lumbar spinal issues, consider working down into your toes, extending through your whole body, stretching your whole body, your hips, your knees, your ankles, your feet, instead of just your back. You should also stretch your back and your neck, but consider the whole body